choose an INI for public health because of the networking, not just so you won't, as a surgical or a medical, you look at hands-on and patient load and all that. Here it is important, but more so about what kind of funding, what kind of connection, what kind of people that come into such institutions. That's very important. Early on, gives you a boost.
So, sir, can you list some of the top colleges to pursue MD in community medicine in India? So, sir, what are the different, some real challenges doctors face when transitioning or entering public health or policy or epidemiology careers?
Okay, many of them have this challenge with technical changes. So you will be talking about policies and different terms. So there may be law, legal aspects. There may be topics you are related to finances, economics, then politics, like I mentioned, right? So many topics which you aren't used to hearing from before. You're only used to medical terms. So getting used to it and speaking that language becomes challenging initially. But as you get the hang of it, you kind of are able to speak those terms as well. I faced it actually even during Niti. I was not able to make sense of everything. Then I got into the groove of it. But by that time, my internship also was over. I'm still learning.
So, sir, can you mention like I think is it already covered the different programs that you were part during your residency?
Programs as such, see, any hospital or health center will have its own health program that it's executing. So maybe we were part of this one, uh, RMNCHA, then IHCI, Indian Hypertension Control Initiative, then Village Health Sanitation and Nutrition Day, all the common health programs that was there, NTEP, Tuberculosis Elimination Program, Leprosy Eradication Program, then rabies also. So all the health programs are executed there itself. So it's not that I was specifically part of anything. Yeah. But many of my faculty, like I said, are like nodal officers for many important ones. Like one of my professors was for the National Hepatitis Control Program. Some of them were for Anemia Mukt Bharat. Some of them were for National Mental Health Survey, things like that. So you can work with them to be a part of the project, but otherwise it's more so with at the PhD level.
So, sir, what are the best moments from your residency?
Best moments. Hmm. Best moments, I would say, getting nice feedback from students, saying that discussing with us. I mean, not just me, my other co-residents, co-JRs and SRs, and it changed their perception about community medicine. They actually became interested in it. See, for me, it's an uphill task. I know. I know my baseline. It is rock bottom. So even if it's 1%, I'm happy that I made them interested. And obviously, seeing patients get better, them being interested in the work we do. Yeah, I mean, just being part of that whole ecosystem, I think, was one of the best moments I had. We made a lot of good friends with different departments because I was rotating between all departments. So I got good connections with so many departments, emergency medicine, and pediatrics, and general medicine. So it's good. We formed a good connect with everybody. I think the whole aspect of being with people, connecting with people really makes me happy.
So, sir, if someone is currently in MBBS or in his early PG and wants to build a strong profile, so how should they start building their CV?
You mean for public health or anything for that?
Any like all the aspects of community medicine.
For community medicine specifically, you're saying?
And we
Mm,
can do public health also.
see, actually, I would say at that MBBS level, I would say do a lot of research. Research for that matter, irrespective of what specialty, it gives you perspective. It shows that you're willing to work extra and you have that kind of scientific mind. So do a lot of research, do volunteering. These two things I would say are very strong factors. See, people who go US or UK, they are also asking for research papers and volunteering experiences and all. So doing this community-based outreach activities, be part of social, go to different organizations. They can even, so we are at Unnati, we also have have internships available. You can work with us. Then there are also so many research opportunities you can do with your faculty. And statistics also, we have worked with many medical students also because they don't know statistics, right? So we can help them with that. Whatever it may be, it's about going that extra mile. So research and volunteering, two things will set you apart.
So, sir, moving forward with some light conversation, we'll be moving to the fun segment. We'll be having this or that, a quick.
Hmm.
Uh, I will give you two options. So, which one you prefer more? So, first will be clinical ward rounds or field visits,
Field visits easily.
teaching or policy making.
That's difficult. Hmm. I would say policy making.
MD in India or MPH abroad.
MD in India.
So, sir, now the rapid fire, whichever word comes under, like in your mind under 10 seconds. So, sir, one myth about community medicine you want to bust.
That is boring.
Most underrated skill in public health.
Learning to talk nicely.
One book that changed your outlook.
Gordis textbook for epidemiology.
A public health personality you look up to.
Hmm. Okay. Dr. Abhay Bang.
So, like I stay in Gadchiroli, Dr. Abhabang and Dr. Rani Bang, they are from there.
Yeah. I'm aware. I'm aware. They have search, right? Search. Yeah. I know. They are legends in the field. I mean, see, they did MPH from Johns Hopkins. Then they came back here and they did so much wonderful work. The reason ASHA workers exist today is because of the work they did for community health workers,
I mean, I was just listening to their videos like 2 3 days ago because I
right?
am actively looking content in community medicine. So from that, I just came. I stay in the same district. It's just 23 24 kilometers from my hometown, but I was
Wow.
not much. So my senior works as an intern there, but I was not much aware about it. But now, as I am researching, like they are the leaders in India for community medicine. The work.
Really? See, that's the thing. See, Dr. Abhay Bang is general medicine and Rani ma'am is a gynecologist, right? So, so that's what I'm saying. You people who really care, they get into public health. That's what I'm saying. I'm not saying people who don't are they don't care less or something, but they went the extra mile because of that reason. So yeah, it really shows, man. Very nice. Yeah.
To search during your residency, or
Sorry.
have you been to their program in the
No,
search?
I really want to. I also have a few colleagues in Varda as well, but I really wanted to, but then I got different work opportunities. I had an initial plan to spend 2 3 months going to different public health ventures by such wonderful stalwarts. There's some tribal villages in Chhattisgarh that they have done wonderful work. Madhya Pradesh, Gadchiroli in Maharashtra, Rajasthan. There's so many wonderful things happen. I really wanted to. I think hopefully I'll make time for it. I think I'll connect with you soon. I think I need your lead to get in there and hopefully secure some time with Abhay Bansal.
Yes, definitely. So, if not community medicine, what you would be doing?
I would be a teacher. That's why that question on the teaching or health policy, right? That's a very tricky question. I would have been a teacher. Yeah, definitely. And the thing is, the root word for doctor means to teach. So I think I would have been a teacher. Yeah.
If not MBBS, then what?
If not MBBS, yeah, I would have been a scientist. So I also wrote this exam called KVPY, which is for Kishore Vidya Protsahan Yojana. So I was going into basic sciences, and then MBBS just happened. I would have been at some, I don't know, chemistry or physics or something like that. So yeah, basic sciences I would have gotten into. And definitely in a STEM career, science, technology, engineering, or medicine. So that's I would have definitely been in India.
So, sir, can you list some of the top colleges to pursue MD in community medicine in India?
in India. So AIMS Delhi, definitely. PGI Chandigarh is really good. JIPMA Pondicherry, AIMS Rishikesh definitely falls on that list. AIMS Jodhpur. Then there is All India Institute of Public Health in Kolkata. That is also very nice. Um, then MAMC also in Delhi. That's also pretty good. Then for MPH and other degrees is Indian Institute of Public Health in Gandhinagar. There's one in Gurgaon. Those are also very good institutions. Mm, I would say, yeah, even Sevagram, Government Medical College Barda, that's also a very good place. These are a few that's at the top of my mind. Thing is, INIs, right? They'll give you a lot of opportunities. There's a lot of funding that comes in. So it's always good exposure. So if given an opportunity, choose an INI for public health because of the networking, not just so you won't, as a surgical or a medical, you look at hands-on and patient load and all that. Here it is important, but more so about what kind of funding, what kind of connections, what kind of people that come into such institutions. That's very important. Early on, it gives you a boost. That's what I'm
So there, like I was going through some of the freelancing opportunities that like graduates can do after their MD in community medicine. So can you brief us about that
saying.
also?
Yeah, sure. So some of them freelance, they can do supports for data analytics, but it has to be ethical. You have to use the identified data. You have to work on secure servers. That's the reason I didn't want to do individual freelance work. It has to be a proper company so that clients can trust. That's the reason Certificate started. I thought of freelance, but then we made it a system. So that is one of the few things that you can work on. Then you can also do freelance work for research consulting. You can guide them on how to write papers. You shouldn't do ghostwriting or any of that sort, but you can guide them. So if this is how it's going, you should probably do it this way. Why not change the study design? Why not change the sample size of statistical plan? Things like that. Yeah, I think also sometime part-time consulting for different projects to say from the public health perspective. That is at the later stages of your career. Initially, you may not get much opportunities. Once you're well established, people will come to you saying, "We're doing so and so health project. What are your thoughts? Do you think it's feasible?" So you can do that on the side. And many companies, they may be having you on their advisory board for kind of guiding them on all such things. But you're saying immediately after your MD, I would say, yeah, research data analytics is the way to go for you. And there are many apps now with online consultations and things like that. Being a primary care physician or a family medicine physician, any of that sort, definitely you can do that as well. Online consultation.
Yes, sir. So, sir, moving to the final question of this podcast. So, what advice would you like to give to students or young professionals who are exploring similar pathways, either in community medicine or policy-driven healthcare? So, what are your views on that?
I would say go for it. It's a different path. It's a daring path. It's a scary path because not many people are there. But at the end of it all, it definitely is rewarding. You develop a lot of new perspectives. Go for it and have some basis of some form of a backing in your own skill sets. Keep building on the side. Have something that you can always rely on. At the same time, build something new. So that is my personal opinion. When you're starting out, explore at the same time. Have something that you want to lean back on later on. So a smart thing is you may say have no plan B, but be realistically a person who goes out into the field, right? You should have uh, expectations of things going wrong. But a smart person plans for chaos, not for perfect things. So be realistic, but this is a very exciting field. There's a lot of investment coming in. There's a lot of scope for innovation. It's very exciting times ahead. I would love to connect with you if you're really curious about what you're building and what you want to do in the future. I'll do my best to maybe connect you to a few people or at least give my 2 cents about how you can progress in this. And I'm seeing so many people, they're getting into entrepreneurship, getting into AI courses. Students from my time versus now, it's very different. I'm very happy to see that they're not doing the same run-of-the-mill thing of only doing PG specializations and things like that. So the future is in your hands. A lot more things are happening around the world. Be aware. And most importantly, enjoy what you do. Don't ever feel that you need to explain yourself to anyone, so that you go to bed peacefully. Yeah,
So, sir, thank you so much for doing this, giving all your time, insights, and experiences. I hope like this is a full-fledged masterclass for all those who are looking for such careers, specifically in MD, community medicine, and family medicine. So, sir, thank you so much for your insights. We'll be closing this.
absolutely. My pleasure, Amay. I would have to say you and your team have done a tremendous job of trying to bring together individuals who have done different things. My best wishes to you and your team, and I really hope you end up, figuring out for yourself as well what you really want to do. My genuine wishes, and hopefully, if you're here sometime in Bangalore or anywhere, we'll be happy to catch up. I had a nice conversation. I think I spoke quite a lot for 2 hours. I didn't know when the time passed actually. So I think you're doing a good job with the podcasting, and good luck to you. I hope you grow much further and further. All the best.
Thank you so much for your kind words.